As a tattooist, we need to be really, really mindful of bloodborne pathogens and hygiene. I'm sure everybody who is a tattooist will know this anyway, but someone commented on my video about my home studio. I've still only done one video since then. I've got a lot going on at the minute, and ADHD just pulled my attention all over the place. So I thought I'd do a quick reply video to that comment and talk about the hygiene, because to be honest, I'm not a virologist. I don't know the ins and outs about what pathogens and things there can be. Obviously there's the main ones that we need to be mindful of, which is HIV and hepatitis B, hepatitis C, and obviously needle stick injuries, tetanus, things like that. But the main thing that we need to be mindful of is just adhering to the hygiene practices. I have worked with some tattooists who haven't been on it with their hygiene practices, and it really bothers me, because blood and viruses is not something that you can really fuck about with. So we just have to be mindful, basically. Everything that we all have this, right? Cling film. So actually, some of the things that you can't skimp on when you're a tattooist. So I can't skimp on cheap cling film, because cling film is like my kryptonite. It bothers me so much because I just spend so much of my life trying to find the end of the cling film. If you're a tattooist, you know my pain. So one of the things that we also need, if you are setting up a home studio, obviously we have to have disclaimer forms. I'll just show you an example of one of mine, because this will also help you with your client to know whether they do have any diseases, any bloodborne diseases. And then you can be even more, you should be vigilant anyway, but just be even more vigilant if they do happen to have any, bloodborne illnesses or anything. So this is the one that I have, and this is required as well by law. So this is something, if you've got a home studio, that you will need to set up. And mine literally just has like tick boxes, and it says, sorry. So I'm just getting over a virus. Not a bloodborne one, it's just a throat virus. So heart disease, and it just says like it's a yes, no tick box. Heart disease, eczema, impetigo, hemorrhaging, seizures, epilepsy, diabetes, hepatitis A, B or C, acne, psoriasis, because obviously we need to know about skin conditions as well. Cellulitis, HIV and allergic reactions. You also need to know if they have any allergies, especially when it comes to tattoo inks, because some people who have allergies to things like nickel or titanium can have reactions to coloured inks. So sometimes it's best to just check with them, because I have had people have allergic reactions to coloured inks. And also these disclaimer forms just protect you as the artist as well. It's also good, something that I've done recently because of difficult clients sometimes. At the bottom of the disclaimer form, I now get them to sign an extra part of the form to say that I declare that I am happy with the result of my tattoo and that the artist adhered to hygienic practices. I am fully aware that refunds for the work carried out today are non-negotiable. Do not give refunds. If they leave your studio and they are happy with your work, then they, once they leave your premises, there's nothing you can do about their tattoo. And some people go away and they don't adhere to the hygiene practices that you set for them, and they can get infections. It's an open wound at the end of the day. They can leave your studio even if you've done everything to maintain the hygiene practices. They can still leave and get an infection. This has happened before to me. It doesn't happen that often, but I have had a handful of times over the last 8 years of tattooing where people have gone away and their tattoo has got slightly infected from something that they've done. Either they've gone to the gym, they've got some bacteria in it, or they've sat in the sun after having a tattoo. People don't always look after their tattoos, and you're always the first point of blame when you are a tattooist. So obviously all the things that we use, so bottles for cleaning the skin, they need to be wrapped in cling film. The chair, that needs to be wrapped as well. So I actually use aprons now. So disposable aprons, they're so versatile. I use them for everything. And I actually just put a couple of those I'll tell you what, I've got one hanging up, so I'll show you. This is actually my curtain at the minute because the sun glares through here and there's no curtain. So yeah, these disposable aprons, they're good for everything. They make curtains and you can put them, like literally wrap your chair in them as well. So I have this workspace here, and this gets wrapped in cling film as well. I also wear an apron myself. And if you're like me, you have a pen tattooing machine, I always wrap it up or put it in one of these clip cord covers. And also my tiny little critical batteries that go in the end of my tattoo machine, I always wrap them in cling film as well. Like anything that comes into contact with the blood of the client, it needs to be wrapped. And at the end of the tattoo, we obviously need to be really mindful about cleaning down the surface space and cleaning the chair and anything else that you've used. I mean, I don't have an autoclave, so everything that I use is disposable, but I'm really super careful whenever I like wrap everything up. So like everything will be sort of set up on here and the cling film will be on here and all the ink pots and everything. And once I'm done with the tattoo, what I'll do is just put my gloves on, I'll pick this up really carefully, like at the corners, and then scoop everything up in one go, and then just chuck it all in the bin, change my gloves, and then again I'll just spray everything down and give it all a wipe with some disinfectant wipes. These ones are antiviral and antibacterial, so any bloodborne pathogens that may be lingering in the air, like this is going to kill it anyway. So that once you've wrapped everything up, you don't really have to worry too much about cross-contamination. So I think that's all my knowledge on bloodborne pathogens and shiz. One other thing that I forgot to mention about having a home studio is that you need a clinical waste company to come and collect your clinical waste. So I have a sharps bin. They provide the bins and the sharps bins, and then they come and collect them like once a month. And mine is through PHS. I don't know if they're like national or UK wide, but they are in my area. They might go further afield. I'm not sure, but yeah, that's the company that I set my clinical waste up with anyway. So there we have it. That's all my knowledge on bloodborne pathogens.